Welcome back to Social Policy. This video lecture is going to cover some key concepts or key understandings related to the material covered in Module 3, which has been referred to as sort of the post-war era and the golden age of social policy as it relates to contemporary social policy realities. You have 4 readings assigned this module, which is pretty typical in the course. You should be reading about 100 pages per week as a graduate student in each of the courses that you're taking. Some weeks a few more, some weeks a few less, and this certainly covers that. Excuse me. The Finkel article, well, Finkel might be familiar to you if you went to York. His work gets used quite a lot in social policy at that school. This article is a bit unusual because it is a review of several books that have recently been published, but I think his analysis related to class, gender, and race and complicating the understandings as presented is something that's quite interesting and quite unique. And so I wanted to include it, even though the article is getting a bit old. Wendy McKean's article also looks at the concept of social policy and the way in which our contemporary political and social climate in a Canadian context is really reducing what it means and how it is understood. Hancock, Mooney, and Neal present a relationship between social policy and crisis orientations and the notion of community as important within the context of contemporary social policy, although there are some complications with this notion of community. And then finally, Onashenko and Erbland present the case of Ashley Smith, who you may recall was killed or allowed to die within the penal system in a Canadian context. She did not receive good health care, good mental health care while she was incarcerated and died as a result of a lack of attention by the authorities. But this article also talks about the notion of a policy window or opportunities when social policy change may be possible because of particular circumstances. To present a couple of definitions, when we're talking about social policy, we're talking about the kinds of legislation, documentation, rules and regulations, and sometimes laws that are made by various levels of government or at institutional levels that concern the development of a broad range of social programs. Everything from healthcare to post-secondary education, to income support programs, to safety-related legislation, to court proceedings. But then when we're talking about social welfare policy, we're talking about a subset of policy that focuses primarily on income support programs or other kinds of practical resources that help people function in a day-to-day kind of a way, aimed at producing particular social goods. The notion of the social is something that's important to think about in social policy, and it's sometimes a disputed term in a Canadian context. So Titmuss, who is sort of a famous social policy person from Europe, stated in 1974 that the social is really the non-economic aspects of the society in which we live in, and that policy objectives in this case relate to regulating or engaging with people within the context of society to produce particular outcomes and objectives that may override or replace other potential objectives or outcomes. Graham, Swift, and Delaney, in a more contemporary context, talk about the relationship between overarching goals or visions and values and beliefs. So when we implement social policy, we have a big end game in mind that produces a particular set of values. It orients us to believe particular things are important. And it reflects a kind of social belief that's held by a particular powerful population. It relates to society in that it produces outcomes, goods, harms, challenges, opportunities, threats for people in society and for the society as a whole. It's a way of kind of thinking about what we want our society to look like and then investing particular resources, supports, and possibilities in that outlook. Sometimes it's about influencing legislation or guiding the construction of social policies, and it's definitely ideological in nature. Complicating this idea of the social, we often talk about social conditions, social issues, and social problems in the context of social policy. So social conditions are circumstances, living arrangements, relationships, learning environments, COVID-19 protocols are social conditions, and they affect people's ability to meet their day-to-day needs and their long-term needs as well. Social issues are particular conditions that are perceived to possibly be problematic or to be a trend that's new or different. And we want to attend to those to see if they need to be addressed in order to ensure that we're still able to meet our goals and objectives. So again, the coronavirus is something that is a social issue. It may have and likely will have long-term implications for Canadian society. And so we want to attend to it in order to ensure that we can still meet our overarching goals and objectives. And then we have social problems, which are defined by Hick, as you can see at the bottom of the slide, as a negative kind of social condition that results in some kind of harm or hardship for people and that requires a collective response in order to create improvement. Mullally has a slightly less clunky definition of a social problem from his 2017 book. And he talks about the idea that a social problem is something that is socially constructed. So it's created at the social level, defined, determined, framed, that it has to be societal in nature. So it has to be understood in some way by the collective, or at least a significant portion of the collective. To be a social problem, the particular issue or concern has to affect a lot of people. And of course, we might need to think about what does a lot of people mean? What does a lot of coronavirus cases mean in a small community of 60,000 people? What does it mean in Toronto, where there are many millions of people? We also know that the situation can be improved with some kind of intervention. We don't have a cure for the coronavirus, but we know some things about how to prevent people from getting it or how to enhance the potential that they can return to wellness. And so we want to intervene using those pieces of information that we have in order to prevent or ameliorate the situation. So the notion of a social problem or even a social issue is not static. It's something that changes and is quite dynamic. It relates to particular social values and how these get expressed in policy. And what is understood as the value of the nation at any given time can change. Some of that may relate to what's happening at the popular level, so with the population of Canada or of the globe. But it also relates to the values of political parties and how they encourage or discourage people to take up particular values and beliefs. The response that we're getting to coronavirus from the Trudeau government is likely not the same as the response we might have received if the Conservative Party had been in power or if the NDP had been in power. So values and the way in which a policy situation is framed are definitely related to our understanding of social problems and to shifting the perceptions. Economic or social conditions also matter. Particular economic or social phenomena at a particular point in time can exacerbate or draw attention to particular social problems. Every solution that we have to a social problem usually creates some other new kind of social issue that might eventually become a social problem. If you look at something like the legalization of cannabis, which was undertaken for a variety of different reasons, but one of which was to decriminalize the use of recreational drugs, it's created other new problems. I don't particularly think pot use is a problem, but we have in the paper today a story about someone's homegrown cannabis being stolen out of their backyard by someone who didn't invest the time and energy in growing their own. So we have new problems that didn't exist prior. And so the author, Hick in this case, uses social exclusion as an example. We've tried to prevent the coronavirus from spreading by asking people to stay at home. And for a lot of people, staying at home may affect their mental health negatively, as they may experience pretty significant isolation if being out in the community was the way in which they maintained and interacted with other people through relationship. How social problems are understood and how they should be responded to are very much interconnected. And as I've already said in the previous slide, perceptions change. So what we currently view as a social problem may be something that was socially acceptable in the past. And similarly, what was unacceptable becomes socially acceptable. So I think this is a great symbol of both of those things together. Once upon a time, smoking cigarettes or smoking tobacco was considered something that was harmless. It was innocuous. It was just a social activity that people engaged in. But the more that we learned about tobacco and its effect on health, the more smoking cigarettes became socially unacceptable. At the same time, we now have the legalization of cannabis, which means that smoking pot, which was once a very significant social taboo, is now considered to be something that's as innocuous as having a glass of wine by many people. But it's also smoking. So are we encouraging, well, it's not only smoking, but some people smoke cannabis. So on the one hand, we're talking about smoking as something that's socially unacceptable and that is a social problem that needs responding to, while we're also legalizing and trying to create social acceptance among cannabis use. And one of the ways that cannabis is used is through smoking. So it's a bit of a tension and a double-edged sword, and we often see that in the development of social policy. Like everything in social work, we have particular models or approaches that we consider when we think about social welfare. So 3 commonly discussed models are the residual approach, the institutional approach, and the industrial achievement performance model. The residual approach is all about temporary responses to the people who are most in need. So the response to the social issue or social concern is something that is seen as temporary and time limited. Government ideally plays a limited role, but often serves in some way to redistribute resources or to implement particular programs and services, although they may very well contract those out or divest them to other levels of government. The response to COVID-19 from an income support context is a great example of this. The CERB and the student payment are something that are time limited. So if you receive them, you're kind of in a little bit of a precarious position at the present time because we don't exactly know whether CERB will be renewed or whether people will have to move on to another income support program like employment insurance or Ontario Works. An institutional approach works with the notion of a social minimum or a standardized understanding of the good life or the minimum kinds of resources that people need in order to achieve the good life. Usually these kinds of programs are publicly funded and they're organized around the idea of economic differences that exist within the social fabric that need to be evened out in order to achieve equity. So we see when we think about universal healthcare as one of those kinds of approaches. We've institutionalized healthcare in a Canadian context. It's a publicly funded program for the most part. There are a few exceptions. Not everything is covered. Different provinces have different rules about what is covered, but it is generally speaking publicly funded and delivered by publicly organized services like hospitals and family doctors who are organized under, in the present context, Ontario Health Teams, and prior to that LHINs, and prior to that under the Ministry of Health. These programs create a low stigma service. Everybody, whether you're rich, whether you're Galen Weston, or whether you're an ordinary person, whether you're someone on social assistance, whether you're a child with no income, everyone who has a legal status within the country and meets the requirements is eligible to receive this universal health care, even if they've never paid into the service because their income is too low. This evens out access to health care from the wealthy and the poor, in theory, although if you're wealthy, you could purchase services outside of the country. This evening out allows for those who wouldn't be able to access services to access the same quality of service as someone who is wealthy, again, in theory. We could probably come up with 100 different examples about how that's not true. But if you recall in the Canada A People's History Hard Times segment, many people in Toronto and across the country during the Great Depression had tuberculosis. They couldn't access care for their tuberculosis, and as a result, many people became permanently disabled or died from the disease. Under a universal healthcare model, if you have TB and you're diagnosed with TB, you receive a very rapid care that is really a kind of wraparound service. So even if you live in a shelter, you'll be seen every day by a public health nurse who will provide you with your medications and who will check up on any symptoms you're having resulting from the medications. So we see that this kind of institutional approach can make a pretty significant difference in terms of receiving care, and healthcare in a Canadian context is a good example. Titmuss talks about the industrial achievement performance model, which is a kind of neoliberal contemporary approach. It really reflects conservative values and relates needs to your capacity to work within the economy and to be an effective and efficient worker and to therefore be rewarded for your productivity. It emphasizes a kind of efficiency model at the economic level, and it advocates people receiving incentives for their efforts and rewards. So this, unlike some of the other models, would suggest that it's not necessarily a good thing to redistribute wealth from the richest to the poorest, because people who are rich because they work hard, and therefore their effort should be rewarded with more money, I guess. So a couple of years ago, John Clark, who is a pretty famous scholar from the UK who focuses on social policy, came to work at the school for a couple of months on a fellowship, and he talked to us quite a bit about Titmuss. And he talked about the fact that Titmuss, in many a meeting, was quite concerned about the equalization of women's wages. Because why would you do something like increase the cost of labor, which only reduces industrial achievement, costs more to produce less? It's better to keep women's wages low and to kind of enhance the overall performance of the economy. So it seems like there's maybe some, bias or some normalization of the male breadwinner model under this industrial achievement performance model perspective. But I guess we'll see how we understand that as the course unfolds. And if you're really passionate about wages, women's wages, wage differentials, or the industrial achievement model, it might be something you want to study more in your final paper. Social work has a long relationship with social policy development and policy advocacy. And I think it's important to remember that there is a whole process to developing social welfare policy, and that there are many places in which social workers can enter into the policy development process. This is just one model that demonstrates the development of social welfare policy and the places in which social workers might become involved and intervene. But I also think it's important to remember that in the context of globalization, the development of social policy does not necessarily occur at the national level. It may very well occur at the global level. So as I've mentioned previously, Canada has a number of relationships with the United Nations and the United Nations sub-organizations, World Bank, World Health Organization, UNESCO, Social Development Council, and so forth. The International Federation of Social Workers is the UN branch of social work. The International Association of Schools of Social Work is the global education branch of social work. And these organizations are strongly associated with the UN, and they certainly do their best to influence social policy at that global level. So we might want to think globally when we think about policy development in a contemporary context. But I think we also need to be quite clear that the bilateral agreements or the membership agreements that Canada signs on to with these global organizations like the UN oftentimes supersede any local or national policy development that we would undertake. So, for example, by virtue of being a UN member, we are expected to uphold the population health approach and the social determinants of health. Now, the population health approach was developed by Canadian economists, not Canadian doctors, Canadian economists. And so this national policy became something that is now a global healthcare approach. That's great, except it was developed by economists. So we might want to ask a few things about what the priorities are in that model. So we developed a policy, sent it to the UN endorsed it, the UN then expects member nations to undertake that approach, and so Canadians undertake that approach. Whether or not we still have a government that values that particular approach or orientation to providing healthcare. We'll probably talk more about some of the challenges of that model, but it is a good example of social welfare policy development, not at the national level, well, partly at the national level, but also at the global level. So look up, because that may be where the social policy is coming from, rather than from the grassroots. Social policy occurs at many levels. Again, at the local level, at the provincial level, at the federal level, and then at the global level. And so we may very well have policy outcomes or policy expectations that come from above, but there may still be some possibilities for how those policies actually get administered or delivered at the local level. So there is still a role for social workers in the policy advocacy process. But I think it's also important to know what level you need to operate at when you engage in the previous slide's process as demonstrated. There are many layers and levels operating simultaneously, and so we may have to make decisions about where we focus our energy and our attention if we're engaged in a social policy advocacy or social policy development process. Returning again to the relationship between values and social policy, we know that our perspectives on social problems shift. Under the British Poor Law, our perceptions of poverty, for example, as a British colony, was focused on the fault of the individual. And if we look in contemporary neoliberal orientation, we can certainly see that that is very much alive in our consideration of how we respond to poverty. Rather than responding with mass amounts of public housing to the homelessness crisis, we develop a housing first model, and we develop assessment models that assess people's risk or potential to maintain housing. We may develop a few small numbers of housing projects that are aimed at folks who are vulnerable or at risk of losing housing, but the numbers are very small. And so we still use this individual fault model to orient our response to social policy. We still think about the deserving poor and the undeserving poor. Who is it that is more deserving of public housing, for example? Who is less deserving? The policies reflect these values, and the responses in terms of the delivery of service also reflect these values. So even though these things may seem very historical, they are still part of the contemporary response. The Canadian political spectrum is rooted largely in the liberal or a centrist position. Even our conservatives are pretty centrist. Our Social Democratic Party, the NDP, is still pretty centrist. So liberalism is important as a theoretical understanding that influences social policy in Canada. So the authors in the articles present notions of liberalism that draw on perspectives from classical liberalism, socialist liberalism, neoliberalism, inclusive liberalism. And as the course goes on, I'm going to speak a little bit about post-liberalism, which is something that's a bit more emerging and explains a few things that you might find confusing in terms of what's happening in a contemporary context. So these will come up in the next set of lectures. It is important, and I'll warn you that the liberalism article is a heavy, dense read, so probably not the one to do in the bathtub. But I would also say it's pretty interesting to think about how we assume liberalism means one thing, when in fact there are a lot of different branches that orient themselves in different ways and would be expressed in the delivery and development of social policy and the delivery of social services in different ways. So hopefully this has been an enjoyable mini lecture, and I'll look forward to connecting with you on Zoom.